Hello, my name is Dr. Al-Hadidi and I'm a board-certified dermatologist and internal medicine physician who practices at Oak Dermatology in Naperville and Itasca. And today I want to discuss some important points on the effects of aging on our skin. It's important to understand the structure of our skin and its purpose. The skin is the largest organ of the body and it creates a barrier between the inside of your body and the outside world. And there are three layers to the skin. The top layer of the skin is called the epidermis, and this serves as a barrier, keeping harmful things such as bacteria and chemicals out of your body, and keeping good things such as your electrolytes, your fluids, and your nutrients within the body. The middle layer of the skin is called the dermis, and this provides structure and nutrition to your skin, and it houses your hair follicles and your oil glands. And the bottom layer of the skin is called the fat, which provides insulation and protection to your underlying organs. And like any other organ in the body, the skin can change with time as we age. So this is an image of a man who worked as a trucker for more than 20 years, and he had accumulated significant sun damage on the left side of his face from exposure to the sun while driving. And this picture highlights the two forms of aging that we can see as we get older. The first type of aging is called intrinsic aging, and this is caused by natural aging of the skin, and it occurs really in everybody, and it can affect any part of your body, any part of your skin. You may see thinner, drier, more slack skin, and you may start to notice some fine lines and wrinkles of the skin. To contrast that, extrinsic aging is aging that is influenced by our interaction with our environment. So for example, sun exposure, smoking, and exposure to pollution can cause extrinsic aging. And typically what you may see is the skin can develop deep, coarse wrinkles or a rough, leathery texture, and you can start to see sunspots and broken blood vessels become more apparent in the skin. And with enough sun exposure and sun damage that you accumulate, you may even start to develop precancerous and cancerous spots that we'll talk about shortly. So while there's not much we can do with regards to intrinsic skin aging, we're all going to have some of that. There are some measures that you can take to ensure healthy aging of your skin and minimize your risk of extrinsic skin aging. And so a lot of that involves sun protection. So some recommendations are to check the UV index levels before going outdoors, because this will allow you to estimate how much UV radiation you may be exposed to. And then avoid outdoor activities during midday when the sun's rays are the strongest. Typically that's from 10 a.m. to 4 p.m. And then I recommend wearing sun protective clothing such as long sleeves, wide-brimmed hats, sunglasses, and then on any part of the body that continues to be exposed, it's recommended to wear sunscreen with an SPF greater than or equal to 30. This will block about 97% of UV rays. It's also helpful to consume a nutritious diet that's rich in vegetables and fruits with vitamin C and other antioxidants. The antioxidants will neutralize free radicals in your skin, and these are compounds that can damage the cells in your body. And so again, the antioxidants help neutralize these harmful compounds. It's also important to avoid smoking. Smoking causes constriction of your blood vessels, so you'll have less blood flow to your skin, and this can make healing slower. And then smoking can also decrease the collagen and elastin in your skin. And then it's helpful to see your dermatologist for routine skin exams and also for a custom recommendation regarding any topical medications or other procedural interventions that may help with healthy aging. Now, I'd like to emphasize that as we age, we may start to notice some new growths on our skin. And this can include growths that are non-cancerous, but also cancerous and precancerous growths. So I would like to discuss some of the most common non-cancerous growths first. So one common one is a sunspot or a lentigo or lentiginous. And typically this can look like a brown moth-eaten spot on the skin that affects sun-exposed areas. So for example, the face, the chest, the shoulders are common locations where you may see these sunspots or lentigines form. Another common growth that is benign or non-cancerous is called a seborrheic keratosis. And this might be a light brown to dark brown spot that usually has a stuck-on appearance. Another spot is called the cherry angioma, and this is typically a red spot that forms from a collection of blood vessels in your skin. And then skin tags may also more commonly occur as we age. Typically, you'll see these around the neck, in the armpits, in the groin, any area that has a lot of friction. And each of these can be treated if desired by your doctor. Now, skin cancers and pre-skin cancers of the skin do correlate with total cumulative sun exposure over the years. So you may see these in people who have had significant sun exposure, spent significant times outdoors. So for example, people who have professions that include farming may be more predisposed to developing precancerous or cancerous growths of the skin. But you may also see them in patients who have a low immune system or in patients who have a predisposed genetic condition that causes these to develop. So the first is actinic keratoses. These are actually precancerous spots that usually feel rough. They may appear red in color, and they can occur typically on the face, the backs of the hands, the arms, areas that have high exposure to the sun. And then there are three forms of skin cancer that we talk about most commonly. The first form and the most common form is basal cell carcinoma, and this can look like a red spot or even a colored spot on the skin that can easily bleed. It may have a rolled border, and it may even have an ulcer in the center of the growth. The second most common type of skin cancer is called squamous cell carcinoma, and this can be either a flat or raised rough spot. And then melanoma is the most serious and most deadly form of skin cancer. And this can occur from an existing mole or on normal skin. And it can look anything like a skin colored to red to brown, irregular looking spot on the skin. So it's really important to monitor your skin routinely. And if you notice any spot that's not healing well, or a spot that's changing, or a spot that's new, it's really important to bring those to the attention of your doctor, because it's not always easy to tell whether a spot is cancerous or non-cancerous. And so it's really helpful to utilize your doctor to help you with the diagnosis. Now, another change that happens in the skin is the skin becomes thinner as we age. And so with that comes dryness and itching and maybe even rashes that may form with the skin. As we age, we start to lose the ability to produce our own natural oils. And so that can cause dry skin, and dry skin can cause itchy skin. And so it's helpful to take some measures to try to minimize dryness of the skin and itching. And so one thing I recommend is, instead of using a hot shower or taking a hot shower, it's helpful to take a lukewarm shower, because hot water strips your skin of oils quicker or more than warm water does. Also, try to avoid harsh soaps and loofahs. I would recommend instead using a gentle bar cleanser. And then get in the habit of moisturizing regularly. So I recommend using a thick cream moisturizer, one that comes from a tub, and use that after you bathe, and really on a regular basis from neck down. You may even want to consider using a humidifier to add moisture back into the air. And then if you develop a rash, such as seen in this picture, you may want to see your doctor because you may benefit from a prescription anti-inflammatory steroid cream. Now, another change that happens as we age is we start to have thinning of the skin, but also we start to have less elastin and less collagen in our skin. And this is what provides support to our blood vessels. So when you have less support to your blood vessels, you may be prone to easy bruising or even shearing or tearing of the skin. And so it's really important to be cautious because when you do have skin breaks or shears in the skin, you may be more predisposed to developing infections as well. So again, important to keep that in mind. So just to review, there are several key points that we discussed today. There are many changes in the skin that occur with normal aging, and sun exposure can cause signs of extrinsic and accelerated skin aging, and this can be reduced with adequate sun protection. Both cancerous and non-cancerous growths can develop with time, and so any new or changing spot should be evaluated by your doctor to help you distinguish between the two. And then our skin changes as we age, and we should take caution in protecting it to minimize the risk of excessive dryness and itching and minimize the risk of bruising and skin tearing, which may help prevent any infections forming on your skin. So thank you for your attention. I hope this was a helpful discussion regarding the effects of aging on our skin. And if you have any skin concerns, you can always see one of our providers to help in diagnosing or give you some information as well. Thank you and take care.